next, Chair recognizes Mr. Ross from Florida for 5 minutes.
Thank you, Mr. Chairman. You know, being from Florida, it's interesting. We did a little bit of research, and we saw that for an internal medicine physician, they pay as much as $57,000 for medical malpractice, but yet in Minnesota they pay just a little bit more than $3,000, which makes you wonder whether the injuries are more severe in Florida than they are in Minnesota, or whether it's a result of the litigation environment. And what I'd like to do is just step away from the substantive part of what we've been talking about, not talk about damages or awards, but let's talk about the procedure. For example, in my practice, I will probably say that the vast majority of my cases have resolved at the mediation level, whether it be court-ordered or voluntary. Mediation seems to work. And I guess, Ms. Dorshaw, I would ask you, would you not agree that dispute resolution, as opposed to an actual trial, is more efficient, more effective in getting the needed benefits to the injured parties?
90% of cases do settle, but it's because of the threat of a jury trial, the possibility of a jury trial, that happens. And you take away the jury trial option, and that won't happen. Well,
I'm not saying take away the jury trial, but I'm also saying that when you're in the dispute resolution, a lot of factors come into play as to why you want to settle the case, whether it be because of the facts or the law. And in some cases, it's the burden of proof, is it not?
Well, the cases, the studies that I've looked at least show that the cases that settle, there's negligence, there's error, there's injury. The cases that end up, the small number of cases that end up going to trial are the ones where it's a little more unclear and they need a trial to resolve it. So I think the system as it is right now is very efficient because most cases do settle, and that's really that's a system that really shouldn't be played around with. It's working now.
But in terms of burdens of proof, I mean, different jurisdictions have like scintilla of the evidence as opposed to clear and convincing. And that, would you not agree that a burden of proof will be a factor that comes into play as to whether the party would want to settle?
For example, in Texas, for emergency room injuries, they made the burden of proof so incredibly difficult that it's knocked out every single emergency room negligence case. So what has happened there is the state of care in emergency rooms has become much more unsafe, and you know, that's sort of what's happened there. So yeah, it does vary, and state law does determine that.
Dr. Hoven, with the AMA, are there not practice protocols that physicians, groups, specialties subscribe to in the performance of their duties?
Yes, thank you for that question. Yes, the AMA has been upfront going forward for many years, in fact, since the mid-90s, in terms of measures, development, quality guidelines, outcome objectives. We've had a major role in this and has been applicable, and it is now standard of care. These guidelines are extremely useful in allowing us for evidence-based care.
And not only extremely essential, but they also sometimes lead to the practice of defensive medicine. In other words, if your practice protocol requires that if this diagnosis is made, then this form of treatment is required, sometimes physicians may do that even though they may not need to, just to stay within the realms of the practice protocols.
That is correct. And in fact, legislation needs to be out there that gives me, using my clinical judgment and my clinical knowledge, the ability to provide the best care for that patient at that particular point in time.
Then, Dr. Weinstein, wouldn't you agree that if we had established practice protocols, and we require, by way of the funding of Medicaid or Medicare, that it's contingent, the receipt is contingent upon established practice protocols in each jurisdiction, and those practice protocols are followed, and the burden of proof would then have to shift from the physician to the plaintiff to show that by way of either a clear and convincing evidence that they deviated from the practice protocols or committed egregious error. Would that in and of itself provide a substantial reduction in the amount of litigation and the amount of awards out there?
Well, I think that, first of all medical groups, including the AMA and others, have been working on guidelines, appropriateness criteria to help physicians establish a safer method of practice, but all patients don't fit in every single guideline. Patients are individuals, they have different comorbidities, and so they provide a general framework in which to start. But it's not a one-size-fits-all. Medicine is not like a cookbook that you follow this step and go to this step. It has to be a physician interacting using their clinical skills to determine whether that guideline fits that particular patient or that appropriateness criteria needs to deviate for that individual.
And in those cases where practice protocols are employed, should not the practicing physician have at least the defense that the burden of proof would now shift to that the doctor has established that he did the following protocols that were required of that particular specialty, and now there must be a showing by a greater weight of the evidence, clear and convincing evidence, that then the physician deviated from or committed egregious error.
Well, I think, again, I'm not a lawyer. I can only speak from a physician's standpoint that the guidelines and appropriateness criteria are very good foundations for me as a practitioner to follow or to look at when I see an individual patient. But I have to use my skill and judgment acquired over, in my case, 35 years of practicing medicine to decide if my patient fits exactly that paradigm. Otherwise, I need to have the ability to not have my hands tied, otherwise I'm going to hurt my patient.
Thank you, Dr.
Gentleman's time has expired. The gentleman from South Carolina, Mr. Gowdy, is recognized for 5 minutes.
Thank you, Mr. Chairman. Ms. Dorshaw, I'm going to ask you a series of what I hope are narrowly tailored questions in hopes of an equally narrow